Hello everyone, welcome to another video of our pharmacology class. Today you are going to learn about yet another drug, which is no other than yours truly. My name is Cascara, however I go by many names. My generic name is Cascara Sagrada, but Cascara for most of you since I am commonly known by this name. However, I also have many brand names such as the following. Lastly, my chemical name is Ramnospershana. Aside from having many names, I am also classified according to my therapeutic and pharmacologic functions. My therapeutic classification is laxative, while my pharmacologic classification is stimulant laxative. In order to know if I am safe for pregnant women, I am given a pregnancy category. My pregnancy category is Category C. This means that animal studies on me fail to reveal evidence of teratogenicity. In addition, there are no control data in human pregnancy about me. I am only recommended for use during pregnancy when my benefits outweigh my risks. Now that you know about my basic information, let's move on to the good stuff so you can know me more personally. Which leads us to the question, what is my purpose, what is my function, and how do I do my job? I have a free anthraquinone and hydroxyanthracene derivative or HAD, which give me my laxative action. These compounds promote more peristalsis in the large intestine and at the same time trigger a nerve center which facilitates bowel movement. My active constituents absorb through the small intestine, enter the circulation, and stimulate the autonomic nervous system to create peristalsis. I also contain small amounts of bitter anthracene and aloin compounds which account for my cathartic action. My chemical components also stimulate the organs of the digestive tract, including the gallbladder, pancreas, and stomach, which results in increased digestive fluids. Finally, my laxative effect of Cascara appears to be via induction of the synthesis of nitric oxide. Now let us move on to my pharmacokinetics. I am minimally absorbed from the GI tract. Following oral administration, my anthraquinone glycosides are poorly absorbed until they are hydrolyzed by colonic bacteria. Only then does moderate absorption occur. Unfortunately, my distribution is unknown. Additionally, based on unsubstantiated reports, I have an onset action of 2 to 6 hours. I am generally metabolized in the liver. Initially, I am metabolized in the intestinal wall, but to an unknown extent. However, I generally undergo a hepatic metabolism or am metabolized in the liver. As a common saying goes, what comes around goes around. Thus, I am eliminated in feces, urine, and breast milk. Now that you know my function, you must also know the indications that suggest I am rightfully what you need. I am indicated for digestive problems such as constipation. I am also indicated for joint and muscle pain, gonorrhea, gallstones, and sedentary. However, you must also be aware of my contraindications for you to stay safe. I am contraindicated to appendicitis, kidney disease, intestinal blockages, gastrointestinal bleeding, children, and pregnant women. Before we proceed, I want to ask if you are all still with me. Are you? Fantastic! Now let us tackle my side and adverse effects according to the different body systems. My side effects in the central nervous system are anorexia, cramps, dizziness, and fainting. My side effects in the cardiovascular system is palpitations, while my side effects in the urinary system is discoloration of urine, pink, brown, or red. Lastly, my adverse effects in the gastrointestinal system are diarrhea, nausea, vomiting, and abdominal cramping. We're almost done! Now we only have to tackle your nursing responsibilities as future nurses. Your responsibilities before administering me is to monitor electrolyte balance if significant diarrhea occurs, especially with frail older adults. Second, monitor restoration of normal bowel function. Moving on, your nursing responsibilities during my administration is to inform patient that single dose taken before retiring usually result in evacuation of soft stool 6 to 12 hours later. Educate patient to take me with water on an empty stomach for better absorption. Inform patient that I may discolor urine, black or brown. Monitor for effectiveness of therapy and for adverse reactions. Lastly, your nursing responsibilities after my administration is first to note for soft formed bowel movement when used for constipation, and to evaluate evacuation of colon before surgery or radiologic studies, or for patient with spinal cord injuries. That would be all. Thank you so much for watching and listening. I hope you learned a lot about me, and I hope to see you in our next class. Bye!